A very warm welcome to all of you once again. It is me, Dr. Caswell, Nkuna, coming to you straight live from my live streaming office. And this time around, we're going to be discussing an issue that is going to be quite hot in the coming days, if not in the coming weeks. It is the issue of the return to school for children. And we thought that we are going to be proactive enough and join in the voices that are going to ensure that our children are safe in a manner that would allow for them to return to school without or with minimal risk. As I've said, my name is Dr. Caswell. To those of you who are joining us via Vimeo, you have the ability to send questions as well as to participate in the chat if you so wish. And those of you who are also joining us from the other platforms, including Facebook and YouTube, you might not have as much of an interactive module as you would like to have. However, we are welcoming you to send us your questions to Nkuna at drcaswellinc.com. In that manner, we will be able to receive your questions, and if we are not able to answer them right away, we will then be able to answer them in the future. So here we are, and we are about to start. I just need to also ensure that in this production, we are going to be showing you things that have copyright over this session. So please just bear that in mind. However, we remain available to be of service to our people through and through. Allow me to bring up the presentation so that you guys can be able to see what exactly it is that we are talking about. As I've said, my name is Dr. Caswell Nkuna, and I am a medical practitioner in the field of occupational medicine, and I've been for quite some time, and we are going to be going through this together. I need to just indicate right from the beginning that the purpose for which we have put this presentation together is to ensure that we can be able to avail our services to you as parents, as well as to the broader education sector, whether in the private sector or in the government circles. We are able to do something about it. As I've said, we have copyright issues over this matter, and therefore we would appreciate that you contact us for any assistance and or distribution whatsoever of some of this discussions that we're going to have. However, today's session, as we've said, is that we've assumed that all schools have done risk assessments at some point. And because of that, what we are now starting to actually, where we're starting is that we're saying that we are in the position to offer risk assessment review. What does that mean? We mean that from home to the transport, to the boarding house, to class, and to the playground, there is always a risk. We need to just ensure that we know that risk so that we can have that risk mitigated for. That is what our services entail, and that's where we start. We are also offering to partner with parents and teachers in bringing about innovative solutions that give parents the reassurance through participation in the monitoring programs in a seamless manner. We are going to allude to that a little bit more, and we want to ensure that people understand that whatever we are doing using our XiTe Health EMR app, we are giving feedback in real time. What does it mean? It means that immediately you do what needs to be done, information is sent back to you with regards to the outcomes of what you've just done. We also are able to ensure that we give televisual consultations with your own doctor if the need arises. This we facilitate through our platform for those doctors that have certain technologies. But if they don't have those technologies, during the communication of the real life results, you are able to give your doctor a call, having registered your doctor during the uptake process as a service user in the app. So as and when you've entered his or her details, the message that will come through to you to inform you to consult will also remind you of his or her number, and you will be able to dial it from the screen. Should it be that they have the interactive calendaring system that will allow for the process flow to flow, that link will also be present there. However, it needs to be borne in mind that this can only happen if the doctor himself or herself has registered, or if you as a service provider, as and when you were registering the doctor or putting his information, you were aware of um, the web page that is linked with such kind of facilities. What exactly have we been referring to when we indicated to you that we can give you the services that we have indicated? First things first is that parents, after they have registered and everybody else has registered, including the school and the teachers, they will be able to check their children at home. They answer a few questions on the app about their children's health on or the symptoms, and this will be happening over the secure portal. The screening happens at home in the privacy of your own space. And as a result, we believe that this reduces the exposure to other students who possibly might not be well. However, it is quite important to understand that being unwell does not mean that you have COVID-19. It just means that the child might be unwell. So if at any stage you are in a position where, as you enter the symptoms and your temperature, a message comes to say you are unwell, it doesn't mean you have COVID-19. It is important because at school, should a child be screened and found to be unwell, stigma could be attached to such a child, and labeling might happen that he or she has COVID-19. This because of the fact that as children, they are just bad children, and it is possible that unknown or outcomes that we have not necessarily intended end up being the case that lead to the stigmatization. By doing the screening at home, you limit the contact with the possibility that you might have other students or other persons as you travel to school, as you arrive at school, who might have these and you will be exposed to them. We often say by the time a COVID-19 person of interest is in front of you, it means you yourself have just become a person of interest because of the fact that there has been contact. The app allows for you to do the screening at home and thereby reduces the risk of a child who's sick arriving at school and be contaminating possibly the others, and or for a child who is well to arrive at school and possibly end up being contaminated by possible other students who are probably unwell. We have said that you will get an SMS immediately after submitting the forms on the app, and depending on the outcomes, you will have the option of consulting with your appointed doctor online, as we have indicated previously. Giving you the access will ensure that you are able to do this in the comfort of your home. What about the school? What happens is that first in the app, you need to have the school registered. Once the school has registered, the teachers have to be registered, and ultimately, the students will have to register. For those students who are using public transport organized, though, they will be able to enter the details of their transport providers, and such transport providers will also have to be registered. The employees of the school are educators and support staff who will all do the self-assessment and submit on the secured portal. They will get immediate confirmation of their wellness status immediately they have submitted the assessment or the screening. The school management, as well as the teachers, will get the dashboard reports with drill down functionalities. What we mean is simply that you will get a dashboard of figures as well as pie charts. And if you want to know what information lies behind that, as you drill down, you get to see who is behind that data. For example, you could be screening to see the total number of daily screens that have happened for your class as a teacher, knowing fully well you've got 25 students and you only see 20. What it means is that you will then press the 20 and it will reveal the names of those students who would have taken the screening that morning. We would hope that every parent is going to screen their own child before they arrive at school, and it will then be made easy for everybody. For students, over and above the usual standard precautions, you need to remember that by knowing your risk, you can take precautions and thereby lower the risk. This we mean by those who are using public organized transport can be able to go in a bus with fellow students who have been screened. The driver would have also been screened because his employer would have had to join and they would have had to screen and enter the data before picking up students. This allows for everybody to know that the risk that I am with at any given point in time is but risk that cannot be avoided, but that which can be avoided, we will ensure that it is avoided. Because anyone who screens and is found to be unwell will need to make sure that they can be able to go into a process of ensuring that they clear the disease or condition that makes them unwell before they can return to school. We are advising schools to take a policy of no screening, no entry, because in the event that that happens, that somebody comes to school and has not necessarily been screened, the risk is higher. Our XiTe Health electronic record school support module offers you that daily monitoring and screening. It also offers you the weekly exposure rating with screening. By this, we mean that after each weekend, we all go home as students and we all get to do what families get to do. We travel, we get visitors, and all such kind of things. Our weekly exposure rating app allows for you to actually inform as to what you have been up to, but doing such in a private manner. It allows for you to be able to say whether you've held or have hosted visitors or you've had a travel excursion where you met other people from other areas. Remembering that the risk is associated with where people come from, especially if such areas have high prevalence, it is necessary to understand that should you have been mixing with people who come from high prevalent COVID-19 prevalent areas, the risk is therefore needing to be adjusted accordingly. We do all this without infringing on your privacy, and we ensure that you can do this in a manner that is acceptable. Some people have asked the question, what about the fact that you will need thermometers? And indeed you will, but you will not need the infrared thermometer or scanners, but the simple thermometer that most of us have bought as children were being brought into the families. We bought those. Those electronic thermometers, they do work and therefore they can be used. You might or you might want not to share it between kids, but even if you did, the problem would be minimal in that all of you are inhabiting the same household. However, observing universal precautions will lower the risk of transmission from one child to the other should there be a possibility that one is having COVID-19. Universal precautions, all they mean is that after use of that thermometer, you clean it with an alcohol-based substance and you can reuse in the armpit, but not in the mouth, preferably. As we have indicated, since you have the ability to select your own doctor, you will be able to ensure that the doctor gets a message electronically should you wish to consult him. You also receive an SMS which is reporting live without delay. We have indicated that we have that virtual platform where you can be able to consult for those doctors that have it, and there are dashboards with drill down functionalities. Allow me to give you this as a summary that will indicate as to where exactly what can be done. The parent and child at home will do a screen. They enter into the app and they will get a report via SMS as well as access to previous entries. Should they be using organized public transport, the driver would be having a mobile phone or a smartphone in which he can be able to see who has screened and who has not screened. He will have the ability to drill down and see the names so that he can only allow those students who have been screened to enter the bus, and only if their screening is within normal ranges. If you are not using public organized transport, by the time you get to school, the school management would be having the overall report of all the students who have been screened. Included in this will be the teachers who have been screened, so that they can be able to see which teacher is well or unwell. And those who will be unwell would have had to consult in any case. We have not necessarily put anything about the visitors that possibly happen, but such visitors or that could come to the school, but those visitors will enter there and the teachers will enter over there. It implies that the school will have an overall view of everyone who is a visitor coming this side and a teacher from that side. This we have not included, not because of anything, but because the relationship that a teacher has to his school is an employer-employee relationship. However, this presentation, we have made largely for parents. So, the class teacher will have access after the school has had access, but the class teacher, will only have access to the children that he teaches. Should there be any other gatherings that are organized in a school manner, that school organization or that club, the head of that will also have access to the information as to who of the members have been screened for the day. What is also important is to understand what is accessible at home. It is the screening entry and the report view of the child only. Each child, if you have more than one child, will have a different platform. From the transport side, the owner of the transport company will be able to see the number of screens entered, the report with regards to his or her drivers, but the driver will only have access to the children that he transports. From the school, overall view of all the children, and from class, overall view of the children that are in that class. The school will also have access to the visitor and teachers information, but the students will not have that information accessible to them. Should there be organized gatherings, they will have the report view of that, of the members of that gathering. As we have said, it is important to understand that this is protecting everyone through ensuring that people screen, access their reports, and ensure that they do not risk others in the school system. The reports and the use of this app is mostly accessible via internet from home before leaving for school. Parents will have access to the app and the children will have access to the app and they will enter the information and they will then get the report for which the wellness status of their children will be indicated. For transport providers, they must have screened themselves in order to ensure that they don't endanger others. And they will need to have a dashboard of which children did and were well. This will allow for them to be able to allow students to come onto the bus. From the side of the school management, they will have access to the teachers and support staff, including visitors, and they will have the drill down functionalities. The class teacher will have their own students dashboard with drill down functionalities, with the possibility of ensuring that they can see which students did the screen. It is also important to understand that the school is an employer and therefore the school will cater for its own employees. However, for children, the parents will have to subscribe, and we have three options ranging from 250 Rand per student all the way to 450 Rands. It depends on what other additional options you have put that you need, bearing in mind that the communication is live and all the time you have access to the app. We need to just show you a few of these slides wherein you will be able to see how to access our app. Bear this in mind. The school will register first, the teachers will register second, and the students will register last. This in an attempt to ensure that the student will be able to select the teacher in whose class he or she is, which teacher will be in a particular school. Should you be using public transport, those that have organized public transport, the employer of the or the company that employs or that provides that service will have to register, and its drivers will have to register after so that they can be able to select accordingly. Registration, once we have uptaken, to have access, you'll need to enter onto our secured portal. There are other productions that are talking about the portal that we have put together. You will have to refer to that. Immediately you have entered your screening results, you will get confirmatory emails, or immediately you've registered, you'll get confirmatory emails thereof. This is the same as when you have done your screening. There will be an email as well as an SMS, depending on which subscription level you are at. You will have access to your own data form to update all your information in case it changes. This will ensure that security and guarantee of your privacy is respected all the time. On a daily basis before school, you will fill in the daily screening form, ensuring that you will also be entering your temperature. There is no need to answer personal questions in front of others, as the app is with you all the time in your own privacy. Should it happen that as you enter the screening information and results, your SMS indicate you should consult, for those that have the scheduling manager, they will be able to schedule an appointment. Again, here we will be taking people through this. It is already available. It has been in use for quite some time, more than a year. So we will be able to ensure that people know how to, but it is a very simple tool that allows for you to make your appointment with your treating doctor, have confirmation of the time, and be able to access that consultation online. The dashboards, this is how they look. It is easy. All you have to do is to click on the number. You will then be able to be given the information behind that number. If you click on the graph, the pie chart, you will be able to get the information thereof. Remember, this is a drill down functionality that we provide. We also have the ability to have the daily reminders for this tool so that we can be able to ensure that nobody forgets. What is important is that you guys need to remember that all the time we are here for you. We provide other services over and above these systems. We are able to ensure that all this is done within a very short space of time, and the uptake is going to be electronic. We want to thank you for joining us today. We also want to highlight to you that you will need to send us requests for demonstration. We are able to demonstrate en masse. However, our demonstration will use live data. It implies that you will have your company or school register. We will take a few of your teachers and register them. And we will take a few of the students and register, and then we will demonstrate a live application of the app. You are welcome to send us the requests via email so that we can be able to respond appropriately, ensure that we can schedule that consultation on or that demonstration for you. Let me take this time and thank you for you to be able to have joined us. We appreciate you very much. Should you have any questions, you are welcome to ask, and we will be able to provide those questions and or answers accordingly. We have come to the end of our session. Thank you very much for joining us, and we are going to be producing other live coverings and live stream of information sharing as we go ahead. We want you to understand that our aim is largely to ensure that our people remain as healthy as they possibly can, and we will forever be supporting our people in an attempt to ensure that everybody is covering the next. Let us be our brother's keepers and ensure that we are healthy all the time and we stay safe. Thank you very much. May you be richly blessed.